Perfect. So here, this tool is publicly available for anyone who wants to use it right now. You can see the URL here. It's also in the calendar invite. So the inputs are pretty simple right now. You can enter in one county or multiple counties. We try to pull in what the latest cumulative confirmed case number is. And we require a doubling time. So if we put in, as an example, 6 here right now, we get some numbers back. So high level, this imports data on the number of beds available in each county from the AHA survey. So we have numbers for the number of acute beds and ICU beds for every county, and they're given here. As a default input, we say that 50% of these are available for COVID cases, but this could be adjusted as an input as well. And then we require some assumption about how many symptomatic cases exist per confirmed case. We tried to sort of back out this number for Santa Clara, and we found that the 5 was a good sort of number for right now, but this is off pretty simple calculation and could be off. Then the sort of input data that makes it useful is that we have sources for how many critical acute care, ICU care, and how many severe cases, this would be acute care, we expect per 100 symptomatic cases. And this is based on published rates from Imperial in the UK, as well as the county age distributions. So we sort of apply this to the populations of the counties we're looking at, and we get the expected number of acute and ICU cases over time based on the number of current cases, the number of additional symptomatic cases we expect there to be, and the doubling time. And then you can also see how many ICU beds there are, how many acute beds there are, based on the data we import. Right now, this is only modeling 20 days ahead, but you can increase this if you want. And you can simulate an intervention. This part is sort of the least developed currently because we are having a hard time estimating exactly what new doubling times we expect given social distancing and other interventions. But if you're able to calculate those, which I think Josh might speak to, you can fill in values for what new doubling times you expect and what days you expect those to occur. If you just click here, you get an example. And if you have doubling time changing to 9 tomorrow and 12 in 10 days and 14 in 23 days, then you'll have these lines that are a lot less exponential and more linear. But that's just one example that you can fill in here. That's a summary of the tool. Are there any questions or requests?
Can you also show the using hospitalizations?
Yes. So if you'd rather input the actual number of hospitalizations that you have, you can do that by hitting this. And then we can, say we have 80 hospitalizations currently. Then this will extrapolate out the number of hospitalizations based on the current cumulative hospitalizations, instead of making this assumption about the ratio of symptomatic cases to confirmed cases. So this is sort of a simpler version of the calculation.
This is Jennifer Tong. I'm assuming that the ICU beds for COVID patients and the total and med-surg beds for COVID patients, was that done using the hospital survey data that some of us had provided?
Yes, that's based on survey data from the American Hospital Association. So it's not data specifically from any county here, but just from the national survey. Yeah.
And that's assuming that 50% of those beds are taken up by non-COVID patients?
Exactly. And you can change that. We could make whatever percentage of total beds available to COVID patients, and that would move these lines up.
This is Paul Lorenz, and I would only offer that CDPH enlisted the help of CHA to get more accurate data from the hospitals. I'm not sure if you've had a chance to look at that data. I think as the week goes on here, that data will be more accurate for California.
It might be interesting if you were able, on the left-hand side there where you can input variables, if you can change, maybe it's already there, but if you can change the number of ICU beds, because what we're finding is that it's not a finite number, right? Hospitals can flex that up, even using non-traditional ICU space, non-licensed beds. And so we would love to be able to change the dotted line in gray across there based on what we know about our county's potential to flex up ICU beds and total beds.
Yeah, we can make that possible. That should be pretty simple.
This is super helpful. So I spent the morning basically trying to do this exact thing when somebody on my team pointed out they'd attended NIGM's Grand Rounds this morning and that this was almost hot off the presses. So I'm super excited to get my hands on it.
Great. Please let me know if you have any ideas for new features or changes that you'd like to see. We want to make this tool as useful as possible for you.
It looks like those on the left-hand side, you've defaulted in some numbers like a 7-day ICU length of stay.
Yes, so those can be changed as well, and we have sources for those defaults in the documentation tab here, but they can be changed. Yeah.
That's what I was going to ask. Our limited experience here suggests that 7 days might be on the low side, but I think we'll get more and more data about that as case volume increases.
Yeah.
If I can jump in at this moment, I mean, the one thing I would urge the counties to focus on is, all of these calculations are obviously dependent on the input. Like after that, it's just multiplication. And to the extent we can do whatever we can with our own hospitals, with the county information exchange systems to get the inputs right, particularly the number of people that are in a hospital bed, that is the extent to which these projections will be more useful for planning.
This is George Hahn. So are you taking a single point in time as the seed for your model, or have you taken into account like the last 2 or 3 weeks worth of data in building? You know what I mean?
Yeah, right now this is all anchored on today and just projecting the future. So the way that we sort of take the past into account is just in how we define these inputs. So we try to define these based on what data we have available from the past, but like Nigam said, I think the key is to put in the best possible estimates for the inputs, and then the outputs is just a simple calculation.
Yeah, the thing that I'm struggling with is the doubling time and the interventions of doubling time. And we can plug in numbers, but it would be nice if we had a way to figure out how to get to what is our new doubling time. You know what I mean?
So that I think is possible to estimate from the data that the counties are collecting and actually publicly posting. So for example, Johannes, if I can grab the screen just for a second.
Of course.